everyone. I'm Tracy Moorhead. I'm the President and CEO of VNAA, and we are delighted today to introduce the VNAA membership to our newest partner, Occu-Med. You'll be hearing from two leaders from Occu-Med in just a few minutes, but I wanted to give a bit of background to let you know how we came to this important partnership. Many of our VNAA members are aware that VNAA launched a new strategic plan in December of 2015. So as we're a year into that plan, we are continuing to execute against some of the strategic goals. In the development of that plan, we really recognized some of the key challenges that our agency provider members were confronting and sought to envision solutions to help our agencies address those challenges and overcome them. One of the strategic goals included in that plan is to ensure success both at the industry level, at the organization level, VNAA, and also at the agency level. In each of those areas, we wanted to identify specific challenges, whether they were financial management and leadership challenges, workforce-related challenges, or quality improvement challenges, that we at VNAA could help provide resources, solutions, case studies, and best practices to improve the performance of our industry and especially our agencies. One of the key challenges that we recognized both at the board level and at the strategic planning committee level were the challenges around workforce, not only in recruiting enough qualified workers, given the nursing shortage in this country and the age shortage as compared to the demographics that we currently confront with patients utilizing greater and greater levels of home-based care services, but also in the retention of qualified and skilled workers. As we began to build out some of the opportunities to address the challenges around workforce, retention and recruitment and screening seemed to be a key consideration that many of our agencies were looking for resources to help address. When we identified Occu-Med as a potential partner, we were really delighted to learn of many of the examples of other industries where they have helped agencies and other providers in pre-placement screenings to ensure that they were hiring the right staff who were capable of doing the job and who were likely to be successful in the positions that they were being recruited for. We've been working with Occu-Med for several months now to develop this partnership and to offer these services to VNAA members at a very favorable rate. And I am really excited about the opportunity that Occu-Med brings to our VNAA members as a way to help us address these considerable workforce challenges that our agencies have told us they are confronting. I do hope that those of you who are on the line today or who may be listening to this webinar that we are recording and accessing it via our website in the future will take a moment to look at the Occu-Med website and reach out to determine which services they offer may be best suited to the needs of our agencies in ensuring the recruitment and retention of staff who can help you succeed at the agency level. I'm going to turn the call over now to a dear friend of mine, O'Brien Kelly, who is with Occu-Med. O'Brien is an attorney who has worked in a number of industries, but particularly with medical providers throughout his career. O'Brien recently joined Occu-Med and will give a bit of background on his work there. We'll also hear from Jared Kaji, who is with Occu-Med and who has been instrumental in building out many of the services and programs that Occu-Med can offer VNAA members and other providers in our industry. I want to thank Occu-Med for their partnership to VNAA, and I very much look forward to working with you in the coming years. O'Brien?
Good morning. Thank you, Tracy, very much. And also thank you to Heather and your other staff for working with us at Occu-Med, not only to put together this presentation, but also our partnership sort of from the ground up. As Tracy mentioned, I was a lawyer, a practicing attorney for a long time, and my practice focused primarily on representing healthcare providers, whether that was in litigation or corporate transactional work. And I did not take leaving that practice lightly. And when the opportunity presented for me to join Occu-Med, I looked long and hard at what that would look like. And I, against that background, I was blown away, to use a technical term, by the provision of services and sort of the intersection among medical issues, legal issues, and the business issues that inevitably arise when employers are building out their staffs. And so I have been with the company for less than a year, but in that time, my initial impressions have only been heightened because of the attentiveness to clients' needs in all those areas that Occu-Med staff provides, responsiveness just on all cylinders. And we're very excited to be working with the VNAA members. We have had some initial dialogue with members, and we believe that you will be excited to hear what Occu-Med can offer you at the agency level, and to address the needs that Tracy has identified from your strategic planning. With that, I would like to introduce Jared Kaji. Jared is the Vice President of Occu-Med, has a long and successful tenure here, and is much better than I at public speaking and technology. And with that, I will turn it over to Jared Kaji.
Thanks, O'Brien, and thanks, Tracy and Heather, for working so hard with us to put this together as quickly as we did. I do have to just make one opening comment, and it's that, it's very simple to come together with an organization that understands what its objectives are. And Tracy, you're explaining to us when we first met what success means for you and your members, and of course the variability within that definition was very helpful for us in understanding how to put together this program in a way that would pursue the success that you stated in terms of quality improvement, overall safety enhancements, thereby improving intention and overall financial and production performance.
Thank you.
One quick housekeeping item. I do have it in the chat room. Can you make me presenter from attendee 6? And I don't know what to do with that.
You can just go ahead and ignore that. I think they accidentally hit that button. I'll worry about the chat item.
Okay, cool. Then I will minimize that. All right, well, just to further explain my role here at Occu-Med, I lead our development and operations effort. So any group from VNAA interested in working with Occu-Med will work directly with O'Brien and myself as we develop the specific needs for that membership group, and we roll out an operations plan to fulfill their needs. So I'm going to go ahead and jump into the presentation, and I'll start by explaining a little bit about our company's history and experience. Occu-Med was founded as a result of a federally funded research project that our founder and CEO, Jim Johnson, was selected as the executive director for. The research project was aimed at two major problems that were noticed by California-based counties and cities, where the issues were a rapid rise in the costs or in the number of injuries and the costs related to workers' compensation insurance. And at the same time, in California, they had just published anti-discrimination legislation requiring employers to consider people with handicaps and disabilities. And that caused fear that in addition to these mounting costs related to injuries, now employers were going to have to start placing people with disabilities, and their fear was that that was going to compound the problem. Just to get it very clear from onset, people with disabilities or that are handicapped are not at a greater risk of injury or harm than just your normal person, and we've proven that over time. So Jim was not fresh out of law school, but out of law school, working as a legal intern for the County Supervisors Association of California, and as an attorney that had studied anti-discrimination laws in law school, he took a very interesting approach to dealing with these rapid rises in workers' compensation costs. The fact that stood out in the research section was that 41% of injuries occur to workers during their first year of employment. And the aha moment, which turned out to not be so much of an aha moment, was that they needed to be conducting pre-placement medical exams to find out to prevent these people with pre-existing conditions from being placed into jobs that predispose them to injury. Every employer in that study was already conducting pre-placement medical evaluations. So the objective of the research very quickly changed to let's perform pre-placement physical examinations to let's find out why they're not working and fix the overall system in a manner that doesn't just prevent injuries, but also directly addresses the needs of the handicaps and how they can be placed into a job safely. And so we started that research by better understanding jobs. Everybody in the study had been just hiring a doctor and saying, hey doc, can you tell me whether my person is fit for the job that we've hired them for? And more often than not, that doctor knew nothing about the job. And so that was the first part of the research, was to develop a statistically valid methodology for analyzing jobs. And our system that we use today involves determining each job's most demanding essential job tasks within 19 different physical abilities. And the physical abilities we look at aren't the physical abilities that the work comp system addresses. You know, it's not lift, push, pull, squat. Those aren't things that they teach to physicians in medical school. Rather, we broke the system up into actual physical abilities, things like stamina, explosive strength, hearing and vision, things that they actually teach medical providers to understand in medical school. And then we developed I'll skip that part. So by defining the essential functions of a job, we now created the ability for physicians to make these decisions based on actual job information. But that was only part of the puzzle that needed to be solved. The next component of that was to determine, well, now that we know what jobs can or cannot require, how do we develop a system of, at the time, medical standards, now better defined as medical guidelines, to understand which medical conditions at which levels interfere with those different essential job tasks or those different physical abilities. And so we brought together groups of specialists and subspecialist physicians, cardiologists, pulmonologists, orthopedists, and so forth, and those providers within their respective areas of specialty practice opined as to which medical conditions at which levels interfered with which types of physical abilities at different levels. And so at that point, we had a means for understanding jobs and a separate means for understanding how different medical conditions would interfere with the jobs that we'd analyzed. So those are two pieces of the puzzle. The next piece comes together with a law that's actually effectuated the same requirement that's been in place in California for a very long time across the nation, and that's the Americans with Disabilities Act Amendments Act. And what that law basically states, in addition to several means for dealing with discrimination, is that any medical inquiry, any investigation conducted by an employer into their applicant must be job-related and consistent with business necessity. And that was a great law for Occu-Med, and it was a great law for the nation because it meant that any medical testing that an employer is conducting needs to have a purpose and it needs to make sense. So what Occu-Med has is a methodology for understanding what the most demanding essential job tasks of a job are, the research and knowledge to understand which medical conditions and functional limitations could interfere with the performance of those essential job tasks. And because we know which conditions to look for, we can designate which tests are irrebuttably job-related and consistent with business necessity, which gives us the full circle of tools necessary to facilitate this process. So that's Occu-Med's. So I'll explain a little bit more about our practical experience. So Occu-Med, up until 2006, provided its service in strictly a consultative capacity. So employers would go out and retain their own medical providers to perform the examinations that we designed for them, and thereafter they would send those medical records to Occu-Med's office, and we would assist employers with determining whether their applicants should be medically qualified with restrictions or accommodations, required further investigation, or maybe shouldn't be placed at all. In 2006, that changed because we began working with a multinational defense contracting organization that basically advised us that, hey, we love what your service does. It's mitigated many injuries, and we've noticed substantial reductions in our insurance premiums as a result of that. However, this process just takes too long. And we were pretty shocked by that because our process had always been a same business day process. But what we didn't account for, because it wasn't within our purview, is that the medical providers that the company was retaining were taking as much as, an average of 33 days to complete the medical examination for the completed medical record to Occu-Med so that we could do a same-day turnaround time on the review and recommendation for that candidate's placement. Well, that wasn't acceptable to that employer because 33 days was way too long to wait. And what we found over the last 10 years is that that's far too long for anybody to wait, and really employers want results next day, 2 business days out, the earliest opportunity possible. So what we did in response to that was we took a couple of months to digest the feedback and to build in response to that a system for administering the examination requirements in a timely and swift manner, and in a manner that was palatable to the candidates that you work so hard to recruit. And so next I'll walk through how we administer a legally defensible program, how we arrive at medically appropriate examination and placement recommendations, and then how that process actually works. So
Garrett,
oh, go ahead.
I just want to make sure we're on the right slide. So we've caught up with the slides, I think. Great.
I'm on the legally defensible slide now.
Okay, thank you.
Okay, great. So, sorry, I speak a lot to the experience just kind of off the cuff. I don't put a lot on the slide for that one. So, understanding the legal environment in which placement determinations are made is really the foundation of any effective medical evaluation or fitness for duty program. So, recognizing that there are discrimination and confidentialities that we must abide by, we structure our system to specifically address the requirements of those laws and regulations. So on the page you'll see ADA-AA, which is the Americans with Disabilities Act Amendments Act. And what that law did was, as I've explained already, is it normed the rest of the nation's laws to comply with what we in California had been dealing with since about 2001. And that is that any medical inquiries conducted by an employer must be job-related and consistent with business necessity. Placement decisions and adverse employment decisions made in response to information that's not job-related and consistent with business necessity is inappropriate discrimination. The Americans with Disabilities Act, which has been around far longer than the ADAAA, structures how employers can go about making or conducting these evaluations and thereafter making the placement decisions. So the major takeaways from that law are that any candidate must undergo an individualized assessment. And what that did is it made medical standards patently unlawful. And so even if we know at onset that a candidate is just not going to be able to safely perform a job, the law makes us take a pause. And that pause gives people the opportunity to rebut our findings and to prove that they're actually able to safely perform a job despite what the research says. And that has actually resulted in a very elegant system of making sure that no person is treated like everybody else. Everybody's medical condition is unique to their own, and they should be evaluated on the merits of how that condition affects their own performances. In addition to that, that law, the ADA, also requires assessments of reasonable accommodation. And so what that involves is if a candidate's placement requires, in order for them to safely perform the essential functions of a job, work restrictions or accommodations, then the employer is at very least required to consider those restrictions or accommodations to determine whether they are reasonable or whether alternatively they impose an undue hardship on the employer. And since Occu-Med has conducted more than 800,000 pre-placement medical evaluations, many of them resulting in work restrictions and accommodations, and far fewer resulting in disqualifications, all being legally defended over time, we have the experience and the knowledge to help you navigate the very sketchy terrain of when and if you should make an accommodation or when and if you can defend the determination of an undue hardship. Of course, VNAA members are probably all intimately familiar with privacy regulations because as healthcare, as workers in the healthcare industry, you understand that confidentiality is a very important facet of medicine these days. So Occu-Med will ensure that as evaluations are performed, all Privacy Act and HIPAA regulations are complied with. Even if that means that we have to hound a local clinic to make sure that your candidate signs the required release of information form, that's something that protects everybody and results in a higher standard program. Lastly, there are going to be different state license and private requirements that need to be incorporated into these programs. So if you're a VNAA member and you're providing services to a hospital who's developed their own specific employee health or occupational health requirements, then understanding what those are and communicating between ourselves how we can administer and meet those requirements is going to be fundamental to develop a program that's successful and legally defensible. And then it needs to be medically appropriate, and this is really the nexus of where all of our knowledge and research comes together. So pre-existing conditions and functional limitations that predispose workers to injury can be identified, and injuries can be avoided if first you know what you're looking for. So the way that you understand what you're looking for is by understanding what that job requires and having knowledge of which conditions would interfere with safe job performance. Secondarily, you have to know how to find what you're looking for, and that's where the knowledge of understanding which medical tests and examinations identify the specific conditions we know are of concern, and that's how we're going to find those specific conditions, by administering those specific tests. And then you have to know what to do with what you find, and this is really where the rubber meets the road and where most employers, I don't want to say give up, but I do want to say that less than ideal is generally, attention is generally provided to this area of this work, because more often than not, there's a doctor at a clinic that's just telling you, hire this person or don't hire this person. And unfortunately, for most situations, that's not nearly enough context to make the best decision possible. So knowing what to do with what you find involves a complete understanding of the medicine, a complete understanding of the law, and a great relationship with the employers to understand what their risk tolerances are and how they generally want to deal or cope with people with disabilities coming into their workplace. So what Occu-Med has offered VNAA is an end-to-end solution. We're offering, in part, a turnkey program, but we're also offering the opportunity for customized programs. To that end, turnkey type programs are things like OSHA compliance, respirator protection programs along those lines, bloodborne pathogens and aerosol transmissible diseases protocols. Customized programs involve more, you're giving us the input related to a specific requirement with a hospital that you're aware of, but that Occu-Med would have no means of otherwise understanding. So when we conduct our implementation procedures, although we'll be offering the turnkey solutions, we'll ask questions and rely on you to answer those questions to determine what custom elements are necessary to achieve success with this program. In addition to that, the Occu-Med network is the delivery model through which Occu-Med provides its service on a global scale. We operate in 43 different countries and in all 50 states and the U.S. territories. And that the Occu-Med network is a group of 15,000 some odd medical providers, travel medicine providers, and other specialist office that have been A, oriented to the Occu-Med system, who B, have negotiated very good pricing on the basis of the economies of scale that Occu-Med brings to the table, and that C, are available to VNAA's members in their pursuit of these services. So how does all that come together? Well, Occu-Med schedules the appointments. And the reason Occu-Med schedules the appointments is because we want to be able to control the turnaround time. And so when we approach a client with respect to scheduling, when we're in the implementation process, we're going to ask you to direct us, A, how long do you want us to provide your applicant, and how long does Occu-Med have to get an appointment on the books? Is that 1 business day? Is that 2 business days? We wouldn't recommend going beyond 5 business days because that's a long time to wait just to get an appointment on the books. The next metric that we'll ask you to direct us to administer is, in addition to how long we have to schedule the exam, how long does your candidate have, as a matter of practice, to get into an appointment? So if you tell us, Occu-Med, you have 2 business days to schedule an appointment and 5 business days for that appointment to take place within, you just put a box around the front end of the process that says this is never going to take longer for a week for my candidate to attend the required exam for my place of employment. Now, those metrics will vary from member to member, and maybe even within different areas that member operates within, and you're telling us how to manage that is what's going to dictate the success of the turnaround time. Now, if for whatever reason you have a situation where you need to hire people quickly and you need to have a temporary reduction in those time frames so that you can meet some type of manning needs, then we'd be happy, and as a matter of practice, we regularly modify those time frames to achieve your needs in placing the candidates that you work so hard to find. The other component of scheduling appointments, or sorry, there are two other components to scheduling appointments. One, once an appointment is scheduled, everybody needs to know about that appointment with a need to know. So as the employer, you generally need to know when that is happening and where it's happening so that you have the situational awareness. You need to know when that candidate should or shouldn't be starting. In addition to that, your candidate needs to know when and where the exam is, and so we'll send that written notification to them in addition to whichever appropriate instructions are indicated based on the nature and scope of the examination being performed. So if it's just a basic physical, it's pretty simple to prepare somebody to fill out their requisite paperwork and attend their appointment. But if that examination involves a fasting blood glucose test, then advising the applicant to fast before that test is necessary. If they're going on a treadmill stress test or undergoing some physical ability testing, then having them bring in the proper attire to undergo such testing is also important. And so our system captures those requirements and communicates them instantaneously upon scheduling an appointment so that everybody has the information they need to have a successful examination performed. Failure to do those things results in a need to send people back for multiple appointments, and that costs you time and maybe even candidates. And so we work hard to evade those situations. The other component I was talking about is, although an exam has been scheduled, making sure that it's performed is part of the process, but also gathering the resulting medical records is really the turnaround time problem that we've solved. And we've solved that through a process that we've coined internally as harvesting. Since we know which medical tests have been scheduled and have been performed, and since we know how long each of those tests should take to render a result, we know when to contact the medical providers and do contact the medical providers to gather the resulting medical record at the point that it should be available. So on day one of the examination, we know that the medical history questionnaire, the consent form and release of information form should be available. If you're doing an instant drug test, that should also be available. But at the same time, we also know that if they had a PPD or tuberculosis skin test placed, that person is going to need to return to have it interpreted within 48 to 72 hours, and we'll send that reminder. And we know that if that person had a blood chemistry panel, that it's not going to be available until the next business day. And so having the knowledge to track each test performed and when it should be available allows us to affirmatively gather that information, resulting in a much more swift turnaround time. And so what we commit to on our end is a maximum turnaround time of 4 business days. And that's for a very involved examination. With most traveling nurse and visiting nurse operations, what we're generally doing is maybe a basic pre-placement physical, perhaps a PPD TB skin test or a 2-step, or maybe a quantiferon gold test, and some immunizations. And so my expectation for a process involving those components is that the long pole in the tent is the PPD skin test. So you should have your results at 48 to 72 hours following the date of examination. Exam QA is where we actually match the findings. So, once we gather those medical records, now our job switches to more of a quality assurance and a consultative service. So the first thing we do when we receive the records resulting from that examination is to do a quality check. Were all of the tests that reauthorized performed? Under-testing your candidates or over-testing your candidates predisposes you to legal liabilities that nobody wants to deal with. So we address that upon receipt of those records. Additionally, we want to make sure that what you're paying us to do is actually being performed. So validating the records as they come in to ensure that they're complete, that the testing was documented correctly and that the testing was performed correctly is pertinent to making sure that you're receiving value from your expenditure on this service. So we'll do those things, and anything that fails to meet the quality requirements will be reperformed or otherwise dealt with so that you're not receiving some substandard evaluation or an incomplete evaluation. Thereafter, it undergoes the exam QA process to determine whether that candidate should or should not be placed, and I'll talk about that as we go through the presentation a little bit further. So, working with Occu-Med, it all starts out following our orientation with just a simple submission of a request. So if you're a member that's implemented the Occu-Med system, we're going to have given you a form called the exam requisition form, and requesting an appointment or requesting services for one of your candidates or employees is as simple as filling out that form and sending it to scheduling@occumed.com. And our commitment is that within 2 business hours of receipt of that request, we're going to give a phone call to your candidate and email him or her to get the process going. And thereafter, we will administer the requirements that you've set forth. So here I've used the 2 business day and 5 business day examples that I discussed, but like I mentioned, these are your metrics to dictate to Occu-Med so that we administer a program that meets your specific needs. So in a perfect world, we reach your candidate on the first phone call and we schedule that examination to be performed the very next day. But those metrics allow us to work within a time frame that works for you overall. Also, when we implement, we'll set up certain protocols related to some of the mishaps that may occur in this type program. So if your candidate, for any reason, fails to attend the scheduled appointment, we'll know that on the date of the appointment, and we'll confirm that by redundant points confirmation. So if the medical provider advises Occu-Med that your candidate didn't show up for their appointment, we're not going to rely on that completely. We're also going to call the person that should have attended the appointment to validate that information. Because unfortunately, it's not uncommon for these Occ-Health clinics or mom and pop family practice offices to say, or to have their front office staff switch out at noon, and it's just a matter of the person you're talking to in the afternoon saying, oh no, such and such didn't come in today, when in reality they did, and the first office person didn't do a good job documenting it for the next one. So that's the purpose of the redundant confirmation. In light of that, what we do once we confirm that somebody didn't show up is we reach out to your point of contact, be it an HR person, a recruitment person, or whomever, just to see what you want to do next. We don't want to assume that because that person didn't show up to the appointment that you just want us to reschedule it, unless you set that up as your protocol. Rather, we'll ask the question to you, and you can call your candidate to figure out whether you want to continue with him or her, or you can just tell Occu-Med to re-engage the process, and we will. There are no fees for canceled appointments or no-show appointments. So the medical evaluation is just the date of the examination, going in and undergoing your testing. We're going to confirm that they attended the appointment, and if they didn't, we're going to let you know that, and we're going to initiate the harvesting process on the same date of the examination. So the medical review is a comparison between the examination findings and the requirements of the job. Fortunately for VNAA, the nurse job has been studied to death, and so if we go without job analysis, we're still going to have a really good idea of the essential functions of nursing jobs, and at the point that we find meaningful examination results, there may be a need to discuss what that means for your specific nursing job that that specific candidate is going into. So if we find out that you have a prospective nurse that has completely uncontrolled insulin-dependent diabetes, and that job involves driving and work at heights and administering treatments, if that person is susceptible to hypo or hyperglycemic episodes in a substantial way, then you, by virtue of the law, do not have to place that person in the job, and the accommodations you would want to consider are, can I restrict this person from performing all of those job duties we just talked about, which is most likely an unreasonable accommodation imposed on a hardship. You'd want to walk away from that person. So when we make our recommendations about whether the candidates are fit for the jobs that you've offered them, we use this terminology on this slide. So if somebody's medically qualified, it means that we did not find any of the conditions that we were looking for, and that candidate is able to safely perform the essential functions of the job offered to them. If they are conditionally qualified, then we found one or more restrictions or accommodations, and if we are providing to you a conditionally qualified or CQ medical evaluation summary report, then we've already reached the point of agreeing that these are reasonable accommodations and that this candidate will be placed with these specific work restrictions or accommodations. So a very easy or simple to understand example of that is if you have a nurse that has horrible uncorrected vision, that doesn't mean that he or she can't safely do the job. It just means that he or she needs to wear their corrective lenses at all times while on duty. Very simple example. A more complex example is you have a nurse with a 40-pound lifting restriction, and we have to look really hard about whether you can or can't accommodate that. At the end of the day, if we determine that you can accommodate that and everybody's on the same page, that conditional qualification will effectuate the work restriction with a written employment agreement for the applicant to sign as they come into the job, agreeing to abide by those restrictions. And in that situation, a third page to the agreement for the supervisor to acknowledge the specific work restrictions and accommodations. If Occu-Med finds one or more of the conditions that we were looking for, i.e. we've found something that may predispose this candidate to injury, then we're going to issue a recommendation called Recommendation Delayed for Qualification, or RDQ. We found something and we need to investigate whether this person can safely perform this job or not. More often than not, the additional investigation, and it's the employer's choice, and most employers always decide the same way, is that it's the financial responsibility of the candidate to refute the findings that indicate that they may not be able to safely perform their job. And so to that end, if you get a nurse who has Harrington rods through 12 vertebrae and has 0 degrees range of motion, that's probably going to be a problem. But since the law requires an individualized assessment, the best way to deal with that is to request records and an opinion from that person's treating orthopedist or neurosurgeon that placed those Harrington rods to determine if for whatever reason this person is an exception to the research that we have. In that situation, that person's almost never going to be placed because that's such an extreme limitation. So RDQ is how we effectuate the ADA required individualized assessment, and it finds any requirements for you as the employer to consider accommodations that may or may not be reasonable. So if the next recommendation is conditional offer withdrawn. And so the reason that this recommendation exists is because if we engage a candidate that appears to have a condition that interferes with safe job performance, and he or she just decides, yeah, I agree with that, or I don't, but I'm just not going to respond to it because I don't want to or I don't have the means to, then you as the employer need some administrative means to remove people from that process despite having not definitively proven or completed the process that the law requires to determine that that person should be medically disqualified. So this is an administrative means for removing somebody from a process that wasn't compliant with the system. Medically disqualified means that we found a definitive contraindication to this person's safe performance of the essential job functions with or without reasonable accommodation. So when we've done this, we've already gone through the RDQ process, and in response to what we requested, the candidate has provided definitive documentation that they cannot safely perform the job. And so we'll provide you in those situations with a written report that's much more robust than the standard medical exam summary report, because this is where people may actually challenge the decision in place. And so you need the information you need to effectively defend yourself if somebody files an EEOC grievance or something along those lines. So it will outline specifically the applicant, the job that they are being considered for, the specific medical finding that gave us a reason to conduct a further investigation via individualized assessment, the additional information that was provided in response to that request for additional information, an analysis of which specific job tasks are compromised in light of those conditions with factual medical information to support that, and a recommendation that A, you not place this person because of the appearance of there being at a direct risk of substantial injury or harm with or without reasonable accommodations, but also that you must engage in the interactive process. And the interactive process is basically a last-ditch meeting where you and your candidate meet to discuss whether there are any other work restrictions or accommodations that would have otherwise made this a successful placement. And we've participated in those meetings as recently as yesterday, because it's not uncommon for those to be situations where you just, as the employer, just don't have the requisite medical knowledge. I guess with VNAA this may be different, to understand the different objections that the candidate may have, and it's not uncommon also in these situations for the candidate to be accompanied by their counsel or their attorney in the process. So inviting Occu-Med to those meetings gives you a backstop to respond to whatever questions or concerns your candidate that's not being placed could raise during that interactive process. Pending is there because when we provide you with an annual report, which is a regular or periodic report, which is a regular function of our work, it'll allow you to understand whether somebody's still being considered. So if somebody's initial qualification status was RDQ and it's noted as otherwise pending, it means that person's still going through the RDQ process. So we don't just tell you, hey, we found something and now it's your problem to deal with it. We have part of our services called RDQA, or RDQ Assistance. So when we find one of these conditions that may predispose your candidate to risk of injury or harm, or perhaps patients to injury or harm, we simply notify you that we found something. This way you're not aware of private health information that could later hamstring you for a retaliation situation. Rather, we hold on to that information and we engage your candidates directly to advise them, hey, Mr. or Miss Candidate, we have found X, Y, and Z conditions, and these, within the meaning of the ADA, allow us to conduct further investigation. Your employer requires that you cover the financial expenses connected with this additional investigation, and your employers further outline that you have X amount of time to follow up with it. And in that service, Occu-Med's role is to be the advocate and assistant to your candidate in overcoming this hurdle. We recognize fully that you work hard to find candidates, screen candidates, interview them, and select the one of maybe thousands that work best for this job. We don't want to create any appearance of mistreating or inappropriately discriminating against your candidates, because we want them to get these jobs. So the purpose of this service is to help your candidate understand why they're having to go through this additional process, what specifically they need to gather in so doing, and what the implications of what other additional information they provide have on their being placed into this job. And RDQ Resolution is just in the slide deck because we will not place any limitation on the amount of information or back and forth that we engage with your candidate in, because we don't want there to be any arbitrary limitations on getting that person cleared. So if this candidate wants, or that candidate wants to submit 1,000 pages of medical records from a condition that they just underwent significant treatment for, that's great. We're happy to have that information to evaluate it and to get you an answer as to what that means for their ability to safely perform the job or not, irrespective of what amount of work that takes. And again, there's no variability in charge based on whether somebody's cleared or not cleared. So financially speaking, it's in Occu-Med's best interest to medically qualify everybody, but we wouldn't have the reputation we did if we did that. So honoring our commitment to integrity and diligence allows us to effectively pick and choose the situation where it makes perfect sense to engage in this process to make sure that your candidates get placed as swiftly as they can be, but where appropriate and necessary, further investigation takes place to prevent injuries. That's the end of the slide deck, but there's another component to the service that we didn't talk about, and so I'll just speak to that ad hoc. So in addition to offering pre-placement medical examination and associated diagnostic testing services, we're also offering our OccuVax program, or our immunization program. And so the way that works is when you send us a request, if we've developed a component of your program that involves any amount of immunizations, at onset, when we begin scheduling the exam, we're going to know that, hey, we should gather this individual's existing immunization records or vaccination history to determine what, if any, immunizations they've already documented having received. That doesn't mean that you can't otherwise perform a titer or something along those lines, but using existing information to understand which immunizations are appropriate allows you to not waste money on administering redundant immunizations that that person's already immune to conditions that they're protecting from. So we initiate that process at the same time as we initiate the scheduling process, and otherwise it works exactly the same. We gather the documentation, we evaluate against the requirements of your place of employment, which immunizations they may or may not need additional inoculations for, and we schedule those immunizations within a process that you define. So some employers will say, hey, I run a really tight ship here, I'm very budget-minded, and I only want to administer immunizations if they've passed the pre-placement medical exams. I don't want to do those concurrently. I'd rather wait the extra time to make sure that any money I'm spending on immunizations are for somebody that's definitively going to be placed. Alternatively, some other employers may say, look, I have no time to get this person placed, and I'm willing to risk administering immunizations at the time of the pre-placement exam because I care more about time than I do saving the $80 to $160 for 1 or 2 or 3 immunizations. So that's how we approach that, and our network for travel medicine and immunizations is just as broad as our network for medical examinations. Excuse me. Another area that we will offer support to VNAA members for is with respect to fitness for duty and return to work evaluations. Because Occu-Med's research was built to understand whether people can or cannot safely perform jobs with or without reasonable accommodations, that research is just applicable to employees. The only thing that changes in those scenarios is the legal context. Applicants are entitled to the job that they've been offered. Employees are entitled to much more. And so I guess just to clarify one more item on that is that Occu-Med's assistance and fitness for duty and return to work is completely outside the scope of workers' compensation. Work comp regulations have very specific requirements for who can be involved in determining whether people should or shouldn't go back to jobs. Our assistance is related to non-industrial injuries and also performance-related matters that have been reported to be medical or potentially medically related. And so if you have an employee, John, that every Thanksgiving goes out on a stress claim for 2 weeks, and you know that he's just out hitting the slopes during those 2 weeks every year for the last 5 years, well, you don't have to take that. You don't have to just accept that this person has some purported stress issue at that time of the year every year. Rather, you have the opportunity as the employer to investigate, A, whether that's true and accurate, and B, whether that has any other impacts on your place of employment. So the way that we work with you in this respect is first we need to establish a fact pattern. Why is Occu-Med being asked to evaluate somebody's fitness for duty or fitness to return to work in the first place? Let's talk about that. In response to that, Occu-Med will have an internal meeting with medical and legal experts to determine what's the best strategy for definitively determining if and when this person should return to work with or without reasonable accommodation. And we'll recommend several strategies to you, and oftentimes those strategies may encompass something like, because this person has produced a note from the same doctor every single year, clearly this doctor is familiar with the condition. Let's start the evaluation by asking that specific doctor questions that have been designed in between a lawyer and a doctor savvy on that specific condition of concern that basically eliminates the most common outs that providers use to defend their patients. And I really do mean to defend their patients, because they are not arbiters for the employer in this situation. They're protecting their bread and butter. And so when you direct pointed questions that do not afford the medical provider a way to wiggle around the meaningful questions that we need answers to, you gather the information that you need for, as the employer, to make the right decision. So in a situation where somebody has a stress claim, if that provider can't, A, provide documentation that it's even a diagnosis, or B, effectively define why that functional limitation or restriction exists, then that's your answer. And so I think I've talked a little bit too long now, so I'll close off the fitness for duty and return to work stuff so that we can get some Q&A going.
Thank you so much, O'Brien and Jared. Do we have questions from those on the line, or Heather, do we have any questions in the text
I don't have any questions that have come through the chat feature. If anyone has any questions, please feel free to go ahead and type them in now.
Well, Jared, let me just say what a comprehensive overview that was of the background of the development of your programs and the very comprehensive interaction and engagement that Occu-Med provides to your clients to ensure appropriateness of the hires and the coordination with the medical personnel in the community to provide these screenings. I'm very impressed, even more so than I was before, with the services that you can provide to our members. Can you talk with me about a case study briefly that you may have in working with other clients that demonstrates how you might have helped them change the way they were thinking about the types of folks that they wanted to hire as you go in and work with them to identify those criteria that they need to focus on? How does that typically work with a client?
Well, I'll speak to a case study, and maybe this case study will shed light on how that works with employers. And so our office actually used to be based in Denver, Colorado, and we were working with a large airbag manufacturer when airbags became a requirement for cars. And what they did is they manufactured the explosive component that caused the bags to inflate. And they were a very rapidly growing company, and they had just accepted the fact that, well, because we're growing so quickly, we're going to have more injuries because we just can't afford the attention necessary in light of being this booming business to make sure that people are well trained or that we have a proper safety program. And as they had hit basically a peak in those costs, they had hired a new safety manager, and that new safety manager said, hey, we've got to do something. I'm looking at our work comp loss runs every week, and I'm seeing that there are people that shouldn't have been here in the first place, and we need to do something about it. And this is a company that was paying about just shy of $1 million in workers' compensation premiums per year. And they had gone from having like 50 employees to 300 in a very small period of time. So they came in and they asked us to implement our system, and we did. And very quickly, a couple of things happened. One, within 1 year, their workers' compensation premiums cut in half. And within 2 years, their workers' compensations cut between a quarter and a third of what they had been previously. And so they not instantaneously, but in a very short period of time, accrued more than $1 million of savings just related to their expenses on workers' compensation premiums. In addition to that, because they were losing fewer workers to injuries, their production enhanced. And because their production enhanced and they became a more successful business, their retention improved. So what we start with is just avoiding one injury with the first or second candidate or first handful of candidates that we evaluate. That snowballs into a completely compatible workforce that results in better performance, safety-wise, retention-wise, and capacity-wise.
Great, thanks so much. Do we have any questions?
We do not have any questions.
I think that you've given our folks on the line a great deal of information to consider. I know that you've already been in touch with at least one of our member agencies who's requested more information, and I will certainly encourage the agencies who are on the line to reach out to Occu-Med and answer or ask any questions that you may have about how you might partner with them. You are also welcome to reach out to me at any time to ask me questions about this partnership or the relationship between VNAA and Occu-Med. I'm glad to talk with you about it and help you determine if this is something that may benefit your agency or organization. If we have no other questions, Jared or O'Brien, would either of you like to offer closing remarks?
Just that we're really excited to get started. Like I said, I'm very impressed with how you've led us to understanding what your specific objectives for our program are, and we're excited to help you achieve your goal of success.
And to this is O'Brien. Oh, sorry, Tracy. Just to echo Jared's comments. This affinity partnership is something that we feel very strongly and positively about, not only based on VNAA as a national organization, but also having done some research on the individual VNAs, just the impressive services that the members provide and how you interact with the national organization is a relationship we're looking very forward to developing.
Great, and I will just create a little echo chamber here because I will echo the same sentiment. I'm very excited about the resources and the expertise that you bring to the table to help our members be more successful and help ensure that their workforce is appropriate and ready to provide the services to patients that we ultimately have as our goal. Thank you so much for your partnership. I'm thrilled to be working with you. And again, I encourage our VNAA members to consider Occu-Med as a critical resource for your hiring, recruitment, and retention activities. Everyone have a lovely afternoon. Thank you.
Thanks, everyone. Have a great weekend.
Take care. Bye.
Bye.